Shalom Aleichem and welcome to Mochen Leira Online Smicha. Obviously, anything that's needed for survival, we're allowed to do on Shabbos. So even something that seems to be a question, typically if it's allowed to be done on Shabbos, but because it's needed for survival, all systems go. One of the easy examples that you can find is feeding, nursing a baby. Typically, to milk a cow and milking is a sort of an extension of the melecha of dash, of threshing, because you're bringing out milk, and you're bringing out milk from a body, which Shulchan Aruch says is you're not allowed to stamazai. However, to nurse a baby on Shabbos, because that's its sustenance, you're obviously allowed to. The question is only what happens in a case where it's not the mother wants to get the milk out, not to nurse, rather because she has too much milk and she wants to pump it out, or she wants to get it out to make it's discomfortable for her. It's not allowed to be done on Shabbos. And if it is, are there any limitations? How? Because as I said, it is a tool of mefarik, and mefarik is one of the malachas as an extension of dash. So let's start this conversation by saying that the Alter Rebbe in Hilchos Shabbos, Siman Shin Lamed, Seif Tes, the Alter Rebbe said like this, that a mother obviously is allowed to nurse her child on Shabbos, and he speaks about, in that case, he's talking about a child that we don't even know if he's going to survive. So he says you're allowed to, because if she has a tsar, she's in pain because of the milk that she has, she's allowed to take it out. Even she could do it herself. She doesn't even have to feed that child. If it's a situation where she has tsar because there's too much milk, she could extract it. She could take it out. Why? Says the Alter Rebbe, since this milk is going to waste, she's taking it out just because she doesn't feel good. She has pain, but it's not. Nobody's drinking this milk. Ein boy mishim mefarik. The halacha of mefarik doesn't apply. Ela midivrei soifrim. It's only a rabbinical problem. Umishim tzayra loy gazru. And because this is a situation where she's going through discomfort, she has some pain. The pain overrides the mefarik derabanan, and that's why if a woman has extra milk, excessive milk, and she wants to take it out, she could take it out even on Shabbos. Now, even if the kid is not nursing. Now, some say that the answer is pretty simple. The answer is it is actually a sakana if it stays within her, if she doesn't take it out. Once you enter the word sakana, then all systems go. But even if it's not a sakana, even if it's a tsar, the discomfort overrides the mefarik derabanan. There's another svara. The Alter Rebbe says because it's haylech leibud, it's going to waste, so it's not really mefarik. Others say it goes to waste. The others say the reason why it's only the rabbanan is because it's a malacha she'ena tzricha legufa. She doesn't need this milk right now. She's not doing a malacha to gain what she's doing. So therefore, and on the basis that she's going through tsar, it will override it. Now, when she extracts the milk, the Alter Rebbe uses the word yechayla lahitzia biyada. She could take it out with her hand. How about if they use a pump to pump it out? So the Achrayim it's brought in Shabbos of Shuvas Avnei Mezer or Chaim Simim Zayin. She could even use the keli that's made for this, as long as it's obvious that the milk that's coming out is going le'ivud, meaning you cannot accumulate in a keli. It has to go straight to waste. If it goes into a keli, that's a problem. I read that the Kloisenberger Rebbe thought of an easy way out. Obviously, to pump it out to the floor is disgusting. It's not nice. So he suggested you could do it in a keli, but just make a hole in the bottom of the keli, so a small hole, so it's dripping out already. Accumulating the milk in a keli is a problem because that's too close to mafarik. So most of the opinions, a lot of opinions held that obviously you're allowed to pump it, you're allowed to extract it, but you shouldn't do it in a keli. La halacha, the Shilos Teshuvos Avnei Nezer, as mentioned before, said you could even do it in a keli, but pour it right away out. Pour it right away out. Don't let it sit there because it has to be done going li'ibud. It shouldn't be a malacha. Therefore, pour it right away out. What's right away out? Some say don't even let it accumulate kishir groigris, which is 3 spoonsful. That's the Shilos Teshuvos Har Tzvi, Chelik Aleph, Siman Reish Aleph, says don't let it accumulate that much, but but people, again, as long as you throw it away right away, you don't keep it, it is not a problem. Now, it's brought in Achronim that if she is extracting and not nursing the baby, then try to do it in private somewhere that nobody sees. Now, what happens if she's pumping not to throw the milk out? She's pumping the milk so she should be able to have milk available for the kid because the kid is not nursing, maybe he's not well, he's nursing slowly, he's falling asleep, and she always has to make sure there's milk for the kid. So it's brought in Shmira Shabbos Kol Chasa. He brings in Perek Lamed Vav Seif Chaf Aleph that if that's the situation, you're obviously allowed to pump the milk out even to make it into bottles. So eventually when the kid is wide awake, he'll have what to nurse.